Hi friends, welcome back. I'm Elaine and I'm living with autoimmune disease. And if I've planned this correctly, I am uploading this video on February 2nd. Does anybody have a guess what February 2nd is? Okay, Groundhog Day. You're a good guess. But in the world of rheumatoid arthritis, February 2nd is Rheumatoid Arthritis Awareness Day. I wanted to make a video about what rheumatoid arthritis is and what it's like. I've already uploaded a video about my RA story, and I'll link that down below if you haven't seen that or you're curious about my personal RA story. But I kind of just wanted to talk about today, about RA and give you some facts about it. Okay, so rheumatoid arthritis, RA is what we call it. And it is a autoimmune disease. And if you're not familiar what an autoimmune disease is, it is when your immune system that is supposed to protect you and keep you healthy, turns on your healthy tissue and starts attacking your own body. A lot of patients like to call rheumatoid arthritis rheumatoid disease. And the reason is because the arthritis in rheumatoid arthritis is kind of a misnomer. Arthritis is only one symptom of RA, and if you speak to patients, you would learn that rheumatoid arthritis actually affects a lot more than just the joints. So the systems that are involved in rheumatoid arthritis are the joints, of course, but also it affects the eyes, the heart, the lungs, the muscle, the blood, and the circulatory system. So what does RA feel like? If I'm trying to explain rheumatoid arthritis to someone who doesn't live in a body who has RA, I best describe it as the feeling the day after you've worked out. It's a really hard workout where all your joints and all your muscles hurt. But then there's also the fatigue and the feeling of ickiness that you feel when you have the flu. So if you've ever been sick and had the flu, you know what that feeling of ickiness feels like, and you just feel run down and you're fatigued. In America, 1.5 million people are affected by rheumatoid arthritis. Now, I want to clear things up. People sometimes get confused between rheumatoid arthritis and osteoarthritis. Osteoarthritis is the wear and tear on a joint. So it usually happens with an injury or just because you've lived a long life, or there's actually wear and tear on that joint. And it usually only affects one joint, maybe a couple. And rheumatoid arthritis actually is, like I said, your immune system. And it doesn't just affect one joint, it's usually symmetrical. So if you have this wrist affected, then you'll have this wrist affected. And if you have one knee affected, you'll have your right knee is affected, your left knee is affected. So it will be symmetrical. Not always the case. For me, I have a left hip problem, but not a right hip problem. So it's not always symmetrical, but oftentimes it is. So the way that we treat rheumatoid arthritis as an autoimmune disease is we need to suppress the immune system. Where in osteoarthritis, that wear and tear can usually be treated by an anti-inflammatory medication, and sometimes those are used in RA as well, but you have to actually suppress the immune system because that's the thing that's attacking you. And so we do that by taking different immune suppressants. They are things called DMARDs, and we use biologics, and there's a lot of other things, and I could get into all that, but we use immune suppression. And during the pandemic, you've probably heard a lot talked about immune compromised patients, immune suppressed patients. Well, people with rheumatoid arthritis are those patients. If you're curious about some of the medications used to treat RA, I'll leave you a couple of videos in the description box below that I did on methotrexate and biologics. So hopefully that will kind of clear things up. Now, I could go into a great deal of more information on rheumatoid arthritis, but really I just wanted to pop on here, make an awareness video to share with you, my friends, and with other warriors that maybe you can share with your family or friends, or maybe you can get your story out there for February 2nd, Rheumatoid Arthritis Awareness Day, and just get the word out that RA is not just arthritis. That is only one symptom of rheumatoid arthritis. It is more of a disease affecting our whole body. And that in America, 1.5 million of us are walking around with this disease. If you're an RA warrior and you want to leave any more information about rheumatoid arthritis, please leave it down below, leave a comment so that we can get more information out there. If you're watching this video, just know it is extremely painful. It's extremely bothersome and it really makes you tired. So it is not an easy disease. If you like this video, give it a thumbs up. It helps me. If you would like to come along on my adventure, I'd love to have you. The more friends, the more better. Please feel free to subscribe, and that helps me as well. If you know anybody who could benefit from my channel, just a patient living with autoimmune disease, and giving you some awareness, tips and tricks, and taking you on my adventures, sometimes medical, sometimes fun, please share it with whoever could benefit from it. And until my next adventure, go have yours.